Hi there, this is now the third video, hopefully final one, on using our request one-off test template. And in this video, I just want to briefly show you the other pages in this template. It all works in much the same way for most things. So first of all, we have here obs and samples. Works the same way as the bloods do, where you can future date them. It's a little bit different with the BP that you can record at the same time they've got a PP machine. Or if you want to have a home BP readings, as in average BPs, not simply a one-off. Some things work a little differently. So if, for example, I pick some of these and OK this, it will ask me, do I want to send a task to prepare sample bottles? It varies a bit practice to practice. In some places, it's always GPs who do this, or whoever's requesting. In some places, particularly if you've got kind of multi-site working and remote working, it might be wanting to send a task to, say, reception. And then also there's an option here, do I want to inform the patient? And if I put yes, it's going to put together this. And it's actually put together a bit more information about the samples that are needed, that they don't need an appointment, and so on and so forth. As well as the OBS and samples, we've also developed blood test groups. So the idea of this is to save a bit of time in trying to work out what blood tests are needed for different things. So for example, if you wanted to do a bariatric referral and you clicked that, it would add bariatric referral as the reason for the tests. So when the tests are added to ICE or WebV, staff would be shown that that's the reason for them, and then it would add all of those tests. Just one thing to be aware of, we are trying to make this kind of page work for different parts of the country and to sort of generally follow national guidance. But we are finding that in some areas you've got very particular requirements. And so this won't necessarily tick all the boxes that your area needs. And you might want to do some checking to see how close it is, whether there's things that are missing, things that you'd want to add on. Certain things like ESI you can see as well is checking, is it available to order from your lab? Not all labs let you even order that. We do plan in time to develop this a bit further. Some things in here we're going to add on some more blood tests and put in kind of links to the guidance that drives that. Similarly for 2-week waits, in some parts of the country you've got to have done certain tests before you can refer a patient. So this is very much to support that. Again, though, you would need to look at, does this match what you use in your area? If there's just one thing missing, we might be able to add it on. We're equally conscious of not wanting to put so much in there that it becomes almost useless because you're never going to use it. The codes we've found kind of indicate relevant symptoms, but they don't indicate a 2-week wait referral or anything like that has been done. Med changes. So hopefully you're familiar now, or certainly if you've been using our system for any length of time, that if certain medications are started or changed, you'll see relevant pop-ups like this. Do you want to arrange lipids and LFTs in 12 weeks? There are times, though, when that may not trigger. One example, if, for example, someone's on, I don't know, Ramipril 2.5, and you want to increase that to 5 milligrams, if you just change the dose instructions to take 2 a day instead of 1 a day, there's no way in System 1 to pick that kind of change up. In which case, then you wouldn't see the pop-up that says, for antihypertensive medication, do you want to arrange a U&E and do a blood pressure? So if that hasn't appeared, but you want it to, and you want to arrange that monitoring, then you've got the options here for the ones we've already configured. And launching these, it's a bit more vague and generic because it's not a particular medication that it's picked up. But yeah, you can launch them manually like this. Again, in time, we are planning to add more, but we think these are the most common ones. And we've got some in the pipeline that will be coming soon. Finally, we've got a separate page for investigations. Just to be clear, this is not for repeated investigations. So if, for example, someone needed a 3-yearly DEXA, there's a different part of the system to look at for that. That's this hourglass for requesting regular repeating tests. If you're going to use this, then the way you do it is you set a future date. So let's say we want a DEXA in 2 years. I put the future date there, I pick the relevant test, and it's got to have the exact same date. Again, just because of the vagaries really of how System 1 works and how we've got this working, those dates must be aligned. You can add some notes in here if that'd be useful. The other key bit to be aware of is just to make sure that you as a practice have put things in place to then make sure these referrals are done. Obviously, this is not for inviting patients in. This drops them into report. If they've not been referred or not had it done in that time frame, there's some instructions here. It's not difficult to do or run, and it's probably more efficient again than using sort of scheduled tasks and other things. But yeah, you want to make sure that that's in place rather than just putting it in here and then sort of hoping that someone else picks it up. That's about it for now. We hope it's a really useful template. It's had a lot of work gone into it. There are instructions on different pages as you go and information in here, and we try and keep it up to date and keep developing it. Let us know if you've got anything else you think would be helpful to have here. Thanks very much.